Hey guys, Paul from iDry Needle. I wanted to answer today one of the most common questions we get, especially on level 1 courses, and that is when do you piston versus when do you use stim? If you asked this question, the answer you got was probably it depends, and that's true, but let me give you 3 things to consider that might guide you to either using more pistoning or manipulation of the needle or using more stim. Number 1 is, what is your treatment intent? What is your goal? And that might sound obvious, but think of treating a patient for athletic recovery, to improve blood flow, to decrease pain, improve recruitment. What your intent is for the treatment will typically dictate how much stim or how much pistoning you do. Number 2 is the acuteness versus the chronicity of the condition. In very general terms, an acute or a subacute soft tissue injury, I'm doing less pistoning, less tissue disruption and less mechanical trauma, and using more stim. Versus a more chronic condition, I typically will piston more. You can create more of a proliferative effect with the needle, and then you can also use stim in combination. And lastly, number 3 is probably the most obvious, but it's patient tolerance. We all know that there are some patients that tolerate needling very well, and you likely could use more pistoning versus those that don't, and you're likely going to use more stim. So the answer is it depends, but just 3 things to consider on when you might piston a needle versus using more stim. Hope that helps.